There's a lot of concern about the change from ICD-9 to ICD-10, and I think a lot of it is overblown. What we have is a situation that the appearance of the codes will change, but the diseases don't change. When we think about something as simple as stroke, stroke has always been divided into hemorrhagic and ischemic strokes. But when we talk about ICD-10 and the specificity that's needed, for an ischemic stroke, it becomes important to identify what artery of the brain may be involved, whether it's the patient's left side or right side of the brain, and if in fact there are some deficits, are the deficits going to be on the patient's dominant or non-dominant side? Imagine a physician is talking to a patient, and we have an issue where the patient had had some previous rheumatic heart disease and had some calcifications on his mitral valve. So here we are inside the heart, and we see that the mitral valve is moving, and one of those vegetations just took off, went up the internal carotid artery, went up into the brain through the carotid siphon, went up into the middle cerebral artery and lodged in the branch of the middle cerebral artery, causing an infarct. That infarct is a cerebral infarct due to embolism of the left middle cerebral artery. And that's the way it has to be described for ICD-10.
Children are not just small adults. Pediatric medicine is not the same as adult medicine. At DCBA, we understand this and have developed a CDI program tailored to pediatric hospitals. Do you have a CDI program that fits your hospital? DCBA, for children's hospitals.
Hi, I'm Samantha. This month's Ask DCBA question comes from Hugh. He asks, once and for all, is an arterial blood gas required to get the diagnosis for acute respiratory failure? I have seen several docs document this on their initial impression in the emergency room. What I'm hearing is, we didn't want to waste time on an ABG and just treated it as if it was present. What do the coders need to code acute respiratory failure? What advice do you have for Hugh, Dr. Gold?
That's a good question, Hugh. No, an arterial blood gas is not always necessary with the patient coming through the door. It becomes very important for the coder to be able to validate that something she sees in the medical record in the emergency room is indeed representative of a valid diagnosis. There is evidence of documentation by the nursing staff and documentation by the physicians who are seeing the patient. You may see somewhere in one of their notes, patient is awake, alert, and in no distress. Well, the chances that this patient has acute respiratory failure with that kind of documentation is pretty slim. However, if we see that the patient is breathing rapidly with respirations over 26 per minute, if there's use of accessory muscles or inability to speak full sentences more than 1 to 2 words, then the chances are that acute respiratory failure is a valid diagnosis. And it becomes important to recognize that this is a good diagnosis in a patient who's awake. In a patient who's unconscious, however, there can be very different criteria to look for.
Join us next month for another question on Ask DCBA.
Hi, I'm Amy Free, one of the developers of CDiTrax, a software tool that tracks your CDI program. It's important to most CDI managers that the software be easy to use and not burdensome. You don't have to be a computer expert to use CDiTrax. CDiTrax helps the CDS with their daily workflow. It generates a rounding list where the cases eligible for review are divided up among the CDI staff. They can easily identify cases they've designated for follow-up on a given day, as well as new cases they've not yet reviewed. Data entry is simple and intuitive. The data entered into CDiTrax is then represented in a number of helpful reports. These reports highlight CDS productivity and effectiveness, as well as provider participation and potential needs for education. Then there are overall reports that demonstrate impact of your CDI program. If you'd like a demo of CDiTrax, please email us at support@dcbainc.com.
Do you have a CDI-related question? Go to CDItalk.com to become a member. You don't have to be registered to view, but you do have to be registered to post. Registration is easy. Click on Register in the upper right-hand corner of the screen. Choose a unique username. You will be prompted if you have chosen a name that has already been taken. Create a password and then confirm it. Enter your email and confirm that you have entered it correctly. Answer the random security question. Leave this box checked so you can receive email notifications when there are new posts or when your questions have been answered. After reading over the forum rules, check this box and then click Complete Registration. When you see this message, you know your account has been submitted for moderation and you'll be notified by email when it is activated. If you have any questions, feel free to email me at ssuggs@dcbainc.com.